issues with cardiac kind of events earlier on. And a lot of these do stem from poor diet, poor nutrition, families that are undereducated when it regards specifically to nutrition and how to maintain a healthy lifestyle.
Well, welcome to another episode of Beyond the Scale with Dr. Minera. And today, very excited to present my next guest on the podcast, who has a very accomplished curriculum, I would say. So welcome, Ashley Jeniec.
Thank you.
She has a psychology and with a focus on exercise science degree from VCU. Then she obtained her bachelor's in nursing from Shenandoah University.
Mm-hmm.
She'll correct me if I'm wrong.
No.
And then she proceeded to obtain a master's in pediatrics for her pediatric nurse practitioner degree from Old Dominion University. And she currently is practicing pediatrics at Warrenton Linton Hall Pediatrics. And I'd like to welcome you.
Thank you.
And I want to thank you really for doing this.
I'm excited to be here.
Yeah, no, it's just you and I have been having conversations about your practice and the things that you're doing. And I just love our conversations and how we've been corresponding. Yeah. And so had to have you here. So thanks again.
Well, thanks for having me.
All right, great. So I want to give you an opportunity if you wanted to, expand on those credentials or thoughts before we get started. Anything at all you wanted to tell our audience before we get going?
Not really. I think it's a bigger issue than a lot of people think. And we've kind of changed into this society of convenience when it comes to nutrition and exercise and stuff. So I think it's a huge topic. I love what you do. I love you and Megan. You guys are just so enthusiastic about it, which is great because that's like my biggest culprit is always, looking into like what's driving all of this. How do we make this better for the whole person? So, and obviously I love pediatrics because peds are the best patients ever. No offense to the older people. But.
and that's one of the reasons we felt that, really, really pertinent. And we're really lucky to have you here because we talk a lot about obesity and a lot of people look at it mostly as a issue in adulthood.
Yeah.
And of course, one of the objectives of this podcast is to get specialists here and have a conversation about how overweight issues, obesity, and everything is affecting their particular patient population.
Definitely.
So that's why, like I said, we're thrilled to have you here. And on that note, I did prepare a few questions, and Perfect. I do need my readers, so okay. I apologize.
That's okay. Mine's stay on all the time.
I left those at home. So. So for starters, I wanted to ask you. I think that for the audience to understand, have a little bit of a reference. How many patients, or how often would you say you see patients in your pediatric population who are actually struggling with overweight issues? Is it a common issue? Is it, the exception? Is it, so that's what we wanted to start with you first, just to give us a little perspective.
Definitely. So I think it's a really big issue, actually. We find nutritional deficiencies across the board in pediatric patients, from underweight to failure to thrive all the way up to obesity. And more recently, we're seeing earlier and, prevalence of things like, diabetes kind of setting in a little bit earlier, having issues with cardiac kind of events earlier on. And a lot of these do stem from poor diet, poor nutrition, families that are undereducated when it regards specifically to nutrition and how to maintain a healthy lifestyle. And we're all guilty of it. We're all on the go. Everybody's kind of, doing 18,000 things all at once, unfortunately, right now. So, the meals of convenience have kind of taken priority in a lot of families. So it's a hard thing, but we do see it more, and it's hard when we talk about obesity in pediatrics because nobody wants to hear the conversation of your child's obese or, as a parent, you take that word and you're like, oh my gosh, you're calling my child fat. You are blaming me as a parent, and that's not at all what we're doing. We just know that research supports that the earlier we introduce healthy lifestyle, healthy nutrition, the longevity of a great cardiac output, like a huge healthy lifestyle that we can continue with kind of as we go into adulthood. So if we don't learn these tools early on, then later in life we struggle with these things, because right now we're young and healthy and our body adapts. But over prolonged exposure to this, we see hyperlipidemia, we see the hypertension, we see all these cardiac events, we see children with having more and more issues with it, not only physically, but also emotionally, because these unfortunately are the kids that are a lot of times getting made fun of. And, as we know, sometimes kids aren't always the nicest.
Yeah.
And, these things strike true to the heart. And a lot of kids then start struggling from secondary conditions like anxiety, depression, things along those lines. So it's a very multifaceted, issue that we see, and it's becoming more prevalent than I think it ever has in the past.
You touched on a lot of really important points there. The first, I mean, we've always made an argument, for how it affects a patient emotionally.
Yeah.
The quality of life for a lot of these overweight, obese children is an issue, and we use that term obese very lightly. I think we tiptoe around it, but people have to understand it is a medical term.
Right.
It's not an insult. It's not a label. It's medical. Unfortunately, as you well know, it's been made a negative type of label. And so that brings me to, the next question. And I think, again, you touched on it, really important. I asked you, how many patients or, how often do you see obesity or overweight? I think more importantly, how often do you find parents bringing children to you because they want you to address their overweight issues? Or how many times during a regular checkup, does the patient mention, hey, I would like some help with my weight? Or how do you address when you're looking at the chart and you're visually examining a child and they are markedly overweight or obese, and neither the parent nor the patient have brought it up, you as a provider, how do you approach those things? So it's a multi angle type of question, but I think it all centers around the same situation. How is it being addressed? How is it being brought to you?
So I will say that more commonly, I don't get patients that come to me for nutrition, obesity, health related topics. Most of the time it comes about through their well check. And that's why it's so important. A lot of patients will be like, well, they're not due for vaccines. Why do I need to bring them? It's really important because we check on multiple different things, and there's a lot that changes within a year in a child. So, I think more commonly it's brought up during the well visit. And I try to take an approach that's a little softer, because if I come out right away and say, your child's obese, this is a big deal, it can affect diabetes, it can do, parents are immediately shut down and they're like, okay, whoa, first off, don't call my 12-year-old daughter obese, because, now she's mortified and upset. And now there's this really negative relationship. So I think the biggest thing is kind of establishing that relationship with the family, with the child. And I usually start out by saying, you know what? I don't care what the number is on the scale. Okay. I don't even have my patients check their weight at home, because it's just a number to me. And in a growing child, there's a lot of multiple components that affect their weight. During puberty, we see hormonal changes that can affect that. You see that more commonly in women as they mature, but we also see all different things. Kids a lot of times will take like a big growth spurt, and so all of a sudden their weight will go up a little bit, and then a couple months later they've taken this huge height spurt. So I think I try to definitely approach it. That's part of my job. But I kind of say, hey, look, like, the number on the scale, I don't really care about. Okay. For me, it's the overall picture. I want you to be able to live a really healthy, long life without having any issues or complications. I want you to be able to go out on that soccer field and run around because you want to. And because you want to keep up with other kids, not because you've got so much extra weight that you're carrying that your knees hurt, that your joints hurt, that you just physically are exhausted after, taking one lap. I want you to be able to be a kid and like play with kids, and enjoy it. So I think it's really important to kind of approach it on a topic of, look, I get it's hard. I know I've got kids myself. I know we're at hockey, we're at dance, we're at, I'm working late. My husband's working. So, there's things in life. So we kind of talk about it as the whole family approach too, because it starts from top down, right? If mom and dad, don't financially have a lot of money to get those fresh fruits and vegetables, like, okay, how can we work with you to make that happen? Can we, if you're on food stamps, can we get you through the I'm totally blanking now, but like the food pantry, and kind of walk you through it on like what would be a healthier options. How do we meal prep? How do we food prep? How often should you be eating? How much water should we be taking? Ideally, are we eating a ton of processed foods that has all this extra stuff in it that your body really doesn't need and doesn't know how to process, So I think a lot of it is, this isn't something that was ever talked about in school. We talked about PE and we talked about eating healthy, and you eat your apple and you have your food pyramid, but nobody really ever tells you, like, let's learn to like read labels. Let's learn to look at what's processed, what's not, like what should your body be able to do and how does that break down? So a lot of it's just education and like, coming at it from a point and perspective of compassion, understanding, and saying like, look, I just want the best for your child. I get this is hard. So let's do this as a family. It's not just about what Johnny is eating. It's about what's the whole family eating. Because if you're going to sit here and preach it to your child, but you're eating, that whole pint of ice cream right in front of him, like that's not very fair either.
Right.
So I think it just has to be an entire unit mentality. So that's kind of what I start my topics on and kind of work on it. And then I just kind of start asking questions. So what are the obstacles? How do we get over those? What can I help you with? We talk about blood work with a lot of these kids because we screen a little bit earlier nowadays, for these things like, hyperlipidemia and things along those lines. So, I think the blood work and the cardiology and more of those medical things are a little bit to the wayside in the beginning because I really want to get the big picture. So I think that's kind of how I go about it.
I think it's a big challenge. One of the things I recall about practicing pediatrics was the challenge between treating the patient, doing what's right by the patient, but understanding that you need to have also the
Right.
buy-in from the parents,
Yeah.
because ultimately they're the advocates for the child.
Right.
And so that's one of the biggest challenges I feel in
Absolutely.
pediatrics in general. And when you're looking at patients who are overweight or are obese, we look at trends. So I agree with that. Obviously, when I see a child or even an adult and there's a blip in the chart, well, that doesn't really bother me. Right. As much as, okay, now I see a trend. Now there's 2, there's 3, right. There's 4 different measurements, and now we see the trends going up.
Yeah, absolutely.
So I think that's important as well, and especially in peds because of those growth spurts, because there's ebbs and flows in that regard. One of the biggest challenges I feel, and I think you can definitely speak to this, is that when I see adults, there's a lot of blame and a lot of shame on their participation in this whole situation having developed, right? I'm pretty sure that bringing up the topic of overweight and obesity in a child will kind of like the parent feels it reflects on their inability or their lack of adequacy in parenting.
Right.
And so I'm pretty sure that's why it's, it must be that much more difficult. And, also that wall goes up.
Right.
So again, I mean, what I'm reiterating here is those challenges and how you bring them up. And knowing that maybe only at a well child check.
Mm-hmm.
So with that and given us that introduction, obviously, of how you start to address it, what is your follow-up? Are these kids, are these families, are they receptive? Do you leave it on the family to schedule a follow-up to see how Johnny is doing, with the new diet or whatever? Or is it more, okay, I'm going to schedule a 1-month follow-up? And what does that look like? And how do you incorporate going from a well child and the expectation of, okay, I don't need vaccines and I'll see you next year, to, we have to have a conversation and now I need to bring you in more often for a problem that I recognize, but maybe the parents don't as much.
Yeah, so that becomes really challenging. I find that parents tend to be more, they'll come in for follow-ups and weight checks and things like that on kids who are underweight than I do for the kids that are obese.
Really interesting. Yeah. They perceive that as a bigger issue.
Yes.
Interesting.
Yes. Mm-hmm. So I feel that I'll definitely say, hey, this is kind of what the steps I want to do. I want to get you hooked into, like the wellness centers, and I want to get you hooked into like a nutritionist. Like, let's really kind of have somebody dive in and talk to you about these things. And I mean, as you know, like, unfortunately, we're only given so much time with them. And so to be able to get everything we want, it does take multiple appointments. And so it really kind of comes into like how invested the parents are, because, a lot of this population, a lot of times is, I hear, I can't get off work to come that often. I'm working long shifts. So he gets home from school and he's responsible for, making their snacks and eating. And I try to have dinner ready, but sometimes that doesn't always happen. So I pick up food on the way. So a lot of times we run into these barriers where we're not able to see them as frequently. We're not able to kind of work with them. We don't have the time to kind of explain and break down all of these components that are in this food. So, I try to work on like compliance. I try to get them to come back. I try to, make myself available through other forms like telehealth and things like that. But I see more consistent follow-up in underweight than I do in overweight children.
What local resources do we have? I know it is a multidisciplinary approach. And definitely. I can tell you on a personal level, the way I will manage a lot of my patients, and especially my pediatric population, is I have pre-printed out resources. I have folders. I give them homework. But of course, this is what I do for a living. I address specifically the nutritional, the access to food. I think that's a very important point. Absolutely. Also, that we could spend a whole other podcast talking definitely. About. You could have the best intentions, but if you don't have access to healthy foods because either economically not able to get there or for whatever other reason, then you start to look at, okay, how can I work with the local food pantry and look at what is available and then kind of make this work for them. But with all that said, you talk about the behavioral health, you talk about the nutrition, about the physical activity, exercise. What local resources have you found that we have available here that maybe, parents may not be aware of, or, that they could potentially tap into? Yeah.
So there's like the Keller Center is one that's really good. There's one in Culpeper, a wellness center in Culpeper that does a lot of pediatric obesity. They have nutrition that they use while they're there as well. Fauquier has a nutritionist on staff. So I do send a lot of people there as well. A lot of times it's finding classes within the community. Like there's a lot of, like, you can go onto like mom sites on Facebook and there's like hey, let's do like an active run group. A lot of it's geared more towards kids who are already a little bit more physically inclined. But there's definitely other things. A lot of the schools offer this as well. I talk to them about small things, like if you don't have access, you have a tablet. Everybody has a tablet nowadays, okay? And most people have internet access. So, you can download like a Zumba class online. Do something that's fun. I talk to kids all the time. Find something that's fun. Go and do, run up and down the stairs 10 times. Do something that's accessible to you, that you can do, that you find enjoyable, that just gets your heart rate up. So I tell kids all the time, I'm like, I don't expect you to go out there and run for 60 minutes. Ideally, the goal is 60 minutes of physical activity a day, right? So I'm like, if you asked me to go out and run for 60 minutes, you'd probably be coming and peeling me off of the ground because I'd be dead. So I'm like, break it up throughout the day. After dinner, ask mom and dad, let's go for a walk. Let's go for a bike ride. If it's cold inside, download a fun fitness video that you like, a dance video, jump up and down. Like, I don't care what it is. I just want your heart rate getting up there. And break it up into small groups. Make it more feasible for you so it doesn't seem like this huge, overwhelming task that I have to go and do 60 minutes. Like, nobody wants to do that. I don't want to do that. And I'm a workout junkie. But, I think it's one of those things, making this more available to them with whatever constraints they have. There's some other things that kind of pop up. A lot of the classes that we see, like OTAC, some of these gyms, they'll have local classes that they do. There's a lot of, speed and endurance classes that you can see for kids that they use, but that comes with financial restraints as well, too. So, we have to kind of work within those realms. So a lot of times where I see people that are very financially restricted, I start talking about their school, because a lot of the schools now will offer like, physical activity electives or stuff like that they can kind of get into. And then I try to just make it as plain and simple as possible. Like, what do you like? Do you like video games? Okay, can we do like a VR video game? Can we do the Wii to like work with them to like pull that in? Because if it's not fun, they're not gonna do it. I mean, that's just kids. I mean, that's adults too, but
Yeah,
that's
it's all of us. Yeah,
more so
exactly.
kids.
Exactly. And I
So
love that we actually have VR
yeah,
and the Wii
yeah,
here set up in the office
that's awesome.
as a kind of like a tool
Yeah,
to tell parents or to show parents that we can use what the kids already enjoy.
right,
We can use what they like, what they will probably continue to
right.
utilize. And it's the same thing with all the different things that we approach,
Yeah.
including meal planning and whatnot. So I think, and you bring up a really good point. Also, in today's day and age, if we don't have the resources locally, there is a lot of stuff that you can look at online.
Absolutely.
Always having a conversation with your provider to see, okay, what websites do you recommend?
Absolutely.
What sources do you recommend? But I think that availability is out there for sure.
Absolutely.
So
And I
those are
mean,
great
that
ideas.
being said, too, just, with all of the internet and things like that, parents got to be involved as well. Because,
Yes.
unfortunately, there's a lot of predators out there. There's a lot of information out there. So, yeah,
Yeah.
absolutely. You bring up a great point, making sure that we're using credible sites, that there's certain things that are geared towards children with not underlying condensation or, things that shouldn't be there, essentially.
And I think another important point is with this particular problem, a lot of times I see more the message being transmitted to kids is you need to do something about it versus we will do something about it as a family.
Right.
So setting the example, doing it together, family hikes, family outings, anything that everybody should be invested in helping,
Absolutely.
the patient achieve success. And again, not in a judgmental way. Which brings me to my next question, which is one of the pet peeves, I would say, or one of the taboo type of situations is we've seen a lot of commercialization of loving your body, loving yourself, because we are working a lot on self-esteem and self-worth and self-love.
Right.
And I sometimes struggle a little bit with the message. I understand that we absolutely must promote a sense of well-being, a sense of love for self and for who we are, what we are, and obviously what we bring to the table, to the world, to humanity in general. But is there a fine line between promoting acceptance and promoting a complacency
Mm-hmm.
to continue with an unhealthy lifestyle because we're trying not to crush a child's self-esteem. And is that an important topic that you may have to broach with parents when you try to have a conversation? Do they feel that you are, kind of like crushing their
Absolutely.
their will, their self-esteem? And how do you handle that? So
Yeah.
I
Yeah. I
know it's
mean,
another,
woo, hot topic.
yeah, and a multifaceted question there, but I think
Yeah,
it's important because I
definitely.
think that that's probably one of the reasons why also parents aren't directly coming in and saying, "Hey, you got to help my kid because they're overweight." It's like,
Right.
okay, that's a fine line.
Right.
How do we tiptoe on that one?
Absolutely. And I think, I mean, you hit it right on the head, is that there's definitely a struggle. I am 110% supportive of, positive self-worth, having like a positive outlook on yourself, having that confidence. I think there's a way to navigate these conversations so that it doesn't turn into the opposite, like, oh, you're just calling me fat, or is that what you're doing? And sometimes you'll see kids that will kind of use that as their vantage point where they'll be like, well, you're just calling me fat. And parents are immediately like, it's hard to be a parent these days,
Yeah.
because it's like, I don't want to mess them up mentally. I love them. I'm going to support them no matter what. And I love how they look, how they feel. Um, they're beautiful inside and out. But at the same token, you want to give them that longevity of a healthy life. Because ideally, I mean, the goal as a parent is to raise a healthy, educated child that has a positive, well-rounded outlook, and, that can stay healthy. We don't want, I'm glad we have a society where we do have, pharmaceutical advantages and there's medications that can help with these things. But ideally, I'd like to have no child on any medication. And I would like them to just be able to fuel their body with things that are good for them. So I think it's a really challenging conversation to have. And even as a provider, sometimes it's very awkward to say. So I always remember the cookie sandwich. I don't know if they ever, if you remember that, where, so, always start out with you know what, you're beautiful inside and out. I love the person you're becoming. I think you're so, strong and motivated. As we move forward as a family, I think it's important to focus on a healthy lifestyle so that we can be better in the long run. To me, your physical appearance doesn't matter, but I want what's inside your body to be healthy as much as I want what's on the outside. And so you've got this is the good stuff at the top with the cookie, and then the cream is in the middle where we kind of give that constructive feedback of like, we may not be eating as well as we should as a family. I want to make that a priority. And I think, and then you finish up with as a positive note on the bottom of that cookie sandwich of, this is a goal for all of us. I think one of the things that we can do that could be really segregating for a family is if they're saying, well, you're overweight and you're eating terribly and you need to do this. I mean, immediately, as soon as somebody starts talking to you that way, you shut down. So I think it's all about on how you approach it, how you talk about it, how you make it a family priority. I think we don't let society structure kind of dictate on how we're going to be, but as a family, we're going to make it a priority that we're healthy both inside and out. And how your body looks is how your body looks, but we want to make sure that we're keeping that heart healthy for a really long time.
So yeah, that's a great point where family needs to be involved. Everybody should take responsibility for sure. And one of the things we were talking about body image and how people, how they perceive. I think when I have a conversation with patients and I identify a younger patient, pediatric, my approach is to, like you said, the cookie sandwich, was
Yeah.
it? Okay, I like that.
I'm sure that's not actually a term, but that's what I look at it
But I
as.
like that. Yes, you
Yeah.
start out with, a positive for sure. I think that what's interesting about this particular population is that parents, or maybe, adults in general, don't perceive that the same health risks are at stake here with children as they are in adults. A little different, a little
Right.
different timing, but overall, if you approach it more from the, it's not so much about the weight, that's the end result.
Right.
The issue is the health, the metabolic
Absolutely.
health, the predisposition to all these disease processes and whatnot. So
Yeah.
I think that's is sometimes how I approach it. And I think also patients, thinking of several that have established in my practice recently that are more like in the preteen, teen age group, they have much better understanding. I have a 14-year-old son who is, again, going back to social media and what information they're getting. He's very, very up on, okay, his salt consumption, and he wants to hydrate. And I haven't had the conversation with him. I'm like, where are you getting all this stuff?
Yeah.
Oh, I just saw on TikTok. It's
TikTok.
important. So
I get a lot of information from that.
Very important, and I think that, again, with everything in general, but also in the realm of obesity and overweight, kids are getting definitely targeted with a lot of information.
Absolutely.
They're getting bombarded constantly. So parent participation, involvement.
And supplements.
And yes.
Lots of supplements.
And looking TikTok. At what are they looking at, where they're getting their information,
right.
Vetting their sources. So that's important for sure.
And, with AI, it's like it's popping up on things for them constantly. And a lot of, it's funny that you mentioned that, because a lot of my patients will tell me, oh, well, I'm taking this supplement and I'm taking this supplement. And I'm like, okay, these things also have issues in your body and too much. I mean, everything in excess can cause complications, right? But because it's labeled as a healthy, supplement, and it's labeled as something that's good for you, they're like, oh, I'm definitely going to take it. And in reality, you and I both know that in pediatrics, they metabolize things differently. They hold on to things differently. So these things can build up in their bodies and have just as much detriment as we see with, just improper eating in general. Yeah. So I think it's much more multifaceted, unfortunately, now, because it's such a targeted topic, in good ways and bad ways too.
Yeah. And now the advertisers are targeting this population because they know that they have purchasing power through their parents. But now a lot of these kids have, Apple Pay, and they have all kinds of, like, just with one click, I can buy different things. Right. So I see it goes from, food to supplements to a lot of drinks, like energy drinks and caffeinated drinks, and which also pack on, besides being, detrimental in other ways, it packs on a lot of unnecessary calories as well.
And the sugar in them.
So like I said, being on top of it is important.
Absolutely.
In adults, we notice that with a overweight or an obese population, the utilization of the medical resources, utilization when it comes to physician visits, who uses the ER, who gets sicker, who utilizes more medications because secondary conditions. There is a direct statistical correlation with overweight people being bigger users of the medical sources. Do you see that in pediatrics as well? Does it correlate also? And again, as another point, to parents of, hey, this is they're sicker because of this. Do you see that?
I think kids compensate really well. So I don't necessarily think that they utilize it more for this. I see it more commonly, unfortunately, in our underserved population, because financially they don't have the means sometimes to be able to, access the help that they need or the foods that they should be getting. I will say more of the time they'll use it like the ERs and stuff like that, less for secondary issues and more for just like, emergent things or ear infection, stuff like that. So I don't think we really see that in peds as much, because I just don't think it's that much of a priority or mindset in adults, that our kids could be suffering because of X, Y, and Z. So, I don't see as much of that. I definitely understand the statistics behind it, which is why I try to, educate. and provide them with like resources early on. But as far as like utilizing more of the medical, I think their bodies are just so resilient and they compensate so well early on that we don't see that as much.
And you mentioned demographics, culturally,
Mm-hmm.
demographically, definitely the underserved
Absolutely.
because of lack of access to more nutritional food, which
Yeah.
comes at a price as well. Is there a trend or tendency for other patient populations to be more susceptible to obesity and weight gain than others
I mean,
in your experience? Yeah.
yeah. And I mean, statistically, we know, different ethnicities tend to be higher risk for, coronary artery disease and things like that and obesity. I think I see it most commonly, not necessarily race in nature, but more so with the underserved populations. I
Yeah.
mean, it's just unfortunately they don't have access. A meal from McDonald's is a lot cheaper sometimes for them. It's easier for them. They're working, long hours to try to, make enough money for their family. So, meals of convenience become a thing. They tend to buy the foods that are more packaged that have a longer shelf life, which unfortunately, as we both know, most of those tend to have a lot of preservatives in them, which have a higher sodium content. And that just kind of is this cascade effect of, we try to buy within a budget and grocery, prices right now are astronomical. I mean, I'm feeling it too.
Mhm.
And it's hard to weed out what should I buy to keep in a budget, but also be able to feed a large family. So I think more commonly I see it just with my, underserved area, my and we have a lot of people that live in more of the rural areas, so they kind of struggle with that too. And so, we see things like that. And it's unfortunate because they're not getting the education they need of you can still get healthy foods through other sources. There's amazing farmers out in our area that you can go and get fresh produce from. The farmers market and Saturdays in Warrenton. I love it. They bring all their fresh produce. I know organic is a very big push, but for some people, it's not financially sustainable. But you can still get fresh produce that's not necessarily organic because, as many people don't know, is to be able to find or to label your merchandise as organic, it's a big process and you have to go through a lot of hoops. So a lot of these farmers use very clean, soils. They don't use pesticides, they don't use antibiotics or things like that, but they just can't label it as organic, but it has a lot less of the preservatives that you see in this like commercially advertised foods and things like that. So there's other resources to keep within a budget that we can definitely help them out with.
Mm-hmm. Yeah, I agree. And definitely economics is one of the biggest issues. As a final question for me, and this is
Yeah.
something that I, may be a very complex or very difficult question to answer, but just kind of like starting to think a little bit outside of the box. We recently had a decision made by the government to make medications accessible for weight loss. We know that a lot of these we're looking at, secondary and tertiary prevention, which means the problem has already developed, obviously, and some of the complications of it. And we're trying to either reverse it or minimize the outcomes of it. And I think it's a great first step in the direction of managing the situation. But we know that the problem of overweight and obesity starts much earlier on, where there are not as many medicinal tools. Knowing what resources we have available, where could we potentially, in your experience or from what you've seen, where could we start? Where do we need to start? Does it start in schools, school programs? What kind of policies do we have to have in place to say, okay, yeah, we understand that this first step is take care of the ones who are already there. But if we know that our children are so susceptible and have such limited resources to get good food, and education is a staple, of what we're trying to promote here. At what level are we looking to educate these kids and families so that we don't have that poor outcome moving forward.
So I think at infancy, I mean, even the AAPs recently, made some corrections and suggestions to their recommendations where delaying, introductions of purees until after 6 months because they were seeing a higher incidence of pediatric obesity in these little guys. So, it used to be you could start at 4 months and it's still safe to start. And I do have patients that still start and that's fine. And some patients I'll even recommend starting. But they even made this like, hey, let's wait till 6 months because they're getting enough nutrition from the breast milk or the formula that they don't need all these extra things that their body's still learning to process and metabolize. So I think it starts as early as infancy. I think education is huge. Everybody has access to public school education. So I think, we utilize that. I can't speak more highly of our teachers. They're amazing human beings that I mean, I love my children. I would never want to teach them. So these people are saints in my book. But they're the ones that have a ton, 8 hours a day, they're with these kids. So if we can utilize that and have it into their education system, start learning early, like not just the food pyramid, but like, hey, let's have a label reading section where, we bring in a box that you have at home. Let's go through and kind of dissect it and show them how to read labels, how to go grocery shopping with mom or dad, like how to stay to the outskirts of the grocery store so that you're not filling with a lot of those empty calories and fillers and processed foods. I know one of the public schools actually did a field trip with their students to the grocery store and they just kind of went in with their teacher and they're like, these are healthy foods. This is something I'd stay away from. And I love that. Like, let's get kids excited about food.
Yeah.
Let's get kids excited about what healthy foods are. Let's get kids in the kitchen with you. Help them. It's not always the parent's responsibility to say, this is going to be the meal plan. Talk to your kids. Hey, what will you eat? Like I've got a picky eater on my hands. So, hey, what do you want to eat? Okay, so let's see if we can make some substitutions so that you can still have these foods that you really like, but we make it a little bit more healthy. Tacos are a staple at our house. My kids love tacos. And so, and if anybody ever repeats this to them, I might be outed there, but, cauliflower rice, I throw cauliflower rice into my ground beef and put it in with my tacos. They have no idea. It's a great way to get some extra, veggies in there. And they love it. And so there's ways to kind of, one, sneak it in, and two, getting your kids excited on how to bring it in, and just kind of working with them like, hey, come on, let's go to the grocery store. Look through this aisle. What do you think? Okay, so maybe, this isn't a great option. How about if we look at this one instead? So I think just utilizing the education in the school systems, educating parents, like having them come in and say, make it a big thing. Like I would love for a pediatric obesity month where like in the month of, June, literally all we do is talk about health and fitness and, how does it work for you? Like, how can I help you find something that you like? So I think it's more of just educating and getting them excited for it, using a bonus structure. I love sticker charts for my kids. And I'm like, if you try this, you get a sticker. After like 3 stickers, you get to pick dinner. And if it's pizza that night, then it's pizza that night.
Right.
But
because it's about balance. It's not about depriving or removing things. Yeah.
And I tell them that all the time. I'm like, if you want the cookie, eat the cookie. I eat the cookie.
Right.
If somebody tries to take my chocolate, it's not going to be a pretty thing for them.
Right.
So it's moderation. It's spacing it out. It's, the ebb and flow of it. So I think that's kind of the biggest topic that I try to hit majority of the time is make it fun, make it exciting. Take them with you to the grocery store. Let them learn about what foods are. Take them to the farms. Let them see how it's grown. The farmers markets. And we have great local farmers around here who love educating and they love talking to your kids. Like I take my kids to the farmers markets and the farmers will be like, yeah, we do this. We're growing this right now. This isn't in season. And I love it because they're getting healthy foods and they're learning.
Yeah.
So make it fun for them. That's how it's going to become, instead of a forced thing, more of a habit that they enjoy.
Yeah. And again, it goes back to the same thing, education, but educating with fun, through fun. It doesn't have to be a drab thing.
Absolutely.
I love that you talked about going all the way back to infancy. I'll bring it even a step further back. We know studies do support the preconceptual health.
Absolutely.
Meaning that before you become pregnant,
Right.
you maximize the mother's health condition situation and also her overall weight, because there is a direct correlation between the weight of the mother and that weight at the time of conception and at the time of delivery,
Right.
on how it's going to affect future tendencies of their children. We know a lot about the flora as well. You know, children who come out through the birthing canal pick up their mother's intestinal flora and their, what we call their microbiome, and how that affects their health, including their weight in the future. So a lot of things that we know about, and others that we're just, skimming the surface of. But you're absolutely right. It's not, again, if we're going to talk true preventative medicine and preventative health and preventing these outcomes, it has to start at the time that you're thinking, hey, I think I want to have a child. Okay, let's start this health journey at this point in time, because it's going to affect future generations.
Absolutely.
And so, yeah, I love that. And they're really interesting about the AAP and where their stance is as well. So we're very hopeful that in the future, not only will we make medication accessible, we'll continue to study these medications in children, because we know that they've been approved for, ages as young as 9 and 12, depending on what medicine we're talking about. But before we even get to that point, can we make health fun?
Right.
And I think that that's key. So I love that point of view.
100%.
Yeah. And so, I mean, we could talk, forever. There's so many things, so many topics, and how things really tie in. The whole behavioral component of it, emotional health. I think we're going to have you back definitely to keep on talking about this. But I did want to thank you very much for being part of the podcast. Did you have any final thoughts, any final words of wisdom, anything that you wanted to let our audience know, before we call it a day?
I think as parents, we need to stop beating ourselves up. It's hard to be a parent these days. There's a lot of information out there. So it's super important to have an open conversation with your pediatrician about your concerns. And, a lot of parents don't know this, but you can actually do a parent-only appointment as well. If you're not comfortable having the child there and you want to talk about these issues, you can definitely do that. There's so many more avenues to access of medical care now. Telehealth's a thing, video conferencing's a thing. So, I mean, if there's concerns, if you're not sure, if you're, wanting help, ask. Like, that's what we're here for as providers. I don't want to come and just, spout out the same information to you. I want to know how I can help you.
Yeah.
So, ask for help, ask for resources. I am the first to tell you, if I don't know, I will find out and I will get back to you, because I am not ever going to pretend that I know everything. Medicine is changing all the time. There's, new research all the time. So ask for help, make it fun, but make it a family thing. Make it your family's goal. So just have a healthy lifestyle and enjoy life, have fun, get outside, get off the computers, take that break, have limits, have boundaries. It doesn't make you a bad parent. It makes you giving them a structure to know a well-balanced life. And give yourself some grace, because it's not an easy road, and it's a lifetime thing that you're going to deal with. And it's okay to have ups and downs. So
I love the message because it does. Yeah, it points to exactly what we try to tell our patients all the time. One, having an empathetic provider is important. You can bring your questions, your concerns to them. You're not going to be judged.
Right.
I think that we have an obligation as parents to advocate for our kids because they're not at a level right now that they can advocate for themselves. So I think that that's the biggest responsibility as a parent, is to be an advocate for their health.
Yeah.
And bringing those issues is important. And then not blaming yourself. It definitely is not your fault as a parent, and it absolutely is not your child's fault either. But we definitely have to have these conversations, and that's great advice. I love that they can actually talk to you about their concerns, and then bring the child in later based on whatever conversations you had. So again, I really appreciate you being here. Thank you so much for the conversation.
I had a great time. Thanks for having me.
And like I said, I don't think this is going to be the last time. So I want to thank everybody for tuning in today, and we're hoping to have more conversations like this in the future. So thank you so much.